Thank you very much, and I appreciate your hard work and leadership on this. You've talked about the problems in healthcare with government. It's just not a government problem. You ask any human resources executive about what one of the major problems they have and benefit package, it's the ability to afford healthcare. Healthcare costs are going out of control. If you have an employee with a pre-existing condition and he's in the group and they do the actuarial study, you start getting bills that you can't pay. You ask any human resources what's happened to their insurance costs over the years. It's just going through the sky. If you look at the employee portion of health care, it goes from zero participation to a little bit more co-pays, more deductibles, more costs for the family, on and on and on. Everyone has a great deal of insecurity about their ability to do health care. But then you look at the idea of what happens if you lose a job. If you have a pre-existing condition, you will not be able to get health care until this bill passed. With all this insecurity, your ability to get health care, your ability to be able to afford it in the future, all of these problems in the future, what is the response from the other side about what to do about that kind of insecurity? They says, well, just be strong and go without insurance like me. Well, that is not a particularly attractive solution for those that don't have an alternative, don't have a spouse where you can just jump, you can say, I'm not going to take government policy, I'm going to use my spouse policy. If they have an alternative, or if they're so wealthy they don't need the insurance. Most Americans aren't in that situation. They need health insurance, and this is what is provided. You have access to it, and it is affordable. Everyone in America will be able to afford health insurance in 2014 because those that can't afford it will have subsidies to make sure that they can. So everybody will be able to get it. If you make less than $88,000, you can get health care for less than 10% of your salary. That is not the case now. If you're in the $20,000, $30,000, $40,000, $50,000 a year bracket, if you can get insurance, it's going to be a lot more than that. And so with this bill, people have the security of health insurance that they don't have now, and the bizarre suggestion, just go without insurance, is not particularly nice when you have children that may have a little ear infection. Rather than have them lose their hearing, you can deal with it when it's a little infection. These problems don't grow out of control. We need that security. This bill provides it. And in terms of seniors are particularly helped under this legislation. They can get, those that can't afford the co-pays and deductibles can get their annual checkups without any co-pays and deductibles. We're helping fill in the donut hole. It'll take a little time, but eventually there'll be no donut hole where they'd have to pay all of their drug costs. And it covers, we provide more community health centers, so they'll have better access. We're training more doctors and nurses, so they'll have more professionals. Then you have a chart that extends Medicare. Medicare is extended. We know that Medicare will quote go broke if we don't do anything. It extends the solvency of Medicare. So all of these, lowest prescriptive drug costs, all of these are things that seniors have a particular interest in this. All of that will be lost if this bill is repealed.
If I might interrupt you for just a moment, Mr. Scott. The